Anal cancer is a type of cancer that affects the anus, which is the opening at the end of the digestive tract. The exact cause of anal cancer is unknown, but it is often linked to the human papillomavirus, HPV, infection. Symptoms of anal cancer may include bleeding from the anus, pain or discomfort, itching, and changes in bowel movements. To diagnose anal cancer, a doctor may perform a physical examination, order imaging tests, and conduct a biopsy. Treatment options for anal cancer include surgery, radiation therapy, and chemotherapy. Surgery may involve removing the tumor and nearby lymph nodes, while radiation therapy uses high-energy beams to kill cancer cells. Chemotherapy involves the use of drugs to kill cancer cells throughout the body. In some cases, a combination of treatments may be recommended to effectively treat anal cancer. Early detection and treatment of anal cancer can improve the chances of successful outcomes. If you experience any symptoms or have concerns, it is important to consult with a healthcare professional.
Anal cancer is a rare type of cancer that forms in the tissues of the anus. The anus is the opening at the end of the rectum through which stool passes when you have a bowel movement. Here's an overview of causes, symptoms, diagnosis, and treatment of anal cancer. Causes. The exact cause of anal cancer is not always clear, but several risk factors have been identified. Human papillomavirus, HPV infection with certain strains of HPV is a significant risk factor for anal cancer. HPV is a common sexually transmitted infection. Weakened immune system. Individuals with weakened immune systems, such as those with HIV, AIDS, or those who have undergone organ transplantation, are at an increased risk. Anal intraepithelial neoplasia, AIN. This is a precancerous condition of the anal lining that may lead to anal cancer. Smoking. Some studies suggest a link between smoking and anal cancer. Age and gender. Anal cancer is more common in older adults, and it occurs more frequently in women than in men. Symptoms. Bleeding, blood in the stool or on toilet paper after wiping. Pain or discomfort, persistent anal pain or discomfort. Changes in bowel habits, changes in bowel movements, such as constipation or diarrhea. Anal itching, persistent itching in the anal area. Lumps or masses, the presence of a lump or mass in the anal area. Unexplained weight loss, significant and unexplained weight loss. Diagnosis. Physical examination. The doctor may perform a physical examination, including a digital rectal exam, to check for any abnormalities. Imaging tests such as MRI, CT scan, or PET scan may be used to visualize the tumor and determine its size and location. Biopsy. A small sample of tissue may be taken for biopsy to confirm the presence of cancer cells. Endoscopy, a procedure in which a thin, flexible tube with a camera, endoscope, is used to examine the inside of the anus and rectum. Treatment. Surgery. Surgical removal of the tumor is a common treatment for anal cancer. This may involve removing a small tumor or more extensive surgery for larger tumors. Radiation therapy. High-energy rays are used to target and destroy cancer cells. It may be used alone or in combination with surgery. Chemotherapy. Drugs are used to kill cancer cells or stop their growth. Chemotherapy can be used before surgery, neoadjuvant, after surgery, adjuvant, or as the primary treatment for advanced cases. Immunotherapy. This involves using medications to stimulate the body's immune system to recognize and attack cancer cells. The choice of treatment depends on the stage of cancer, the size and location of the tumor, and the overall health of the patient. It's important for individuals with symptoms or risk factors to seek medical attention for a proper diagnosis and treatment plan. Regular screenings and vaccinations against HPV can also contribute to prevention.